Majority of people, over 90% of our patients, do go home the same day. We want you to get up, walk, move. I tell the patients 3 things you have to do before you go home. Walk, drink, pee. Doesn't sound very medical, but these are the 3 basic things I tell patients they need to do. So if you can walk, and you can drink, and you can urinate, you can go home. Doesn't mean you can't go home if you can't urinate, but if I looked in your bladder and I'm sure that everything looks great, sometimes people have what's called urinary retention, that they just can't urinate after the surgery because of the medications that they're given, and they're still kind of groggy. Sometimes we'll put a Foley catheter in, they take it out in the morning, and they're fine. In either case, we're going to hold your hand the whole way through, both before, in the middle, and after. I want to make sure you know what's happening, you understand what we've agreed upon. It's a joint mutual thing that we have to do as patient-doctor. I want to know as much as possible before we go to the surgery, because I can't wake you up once you're asleep and say, wake up, we have to talk. You know, so at that point it's important that I know what you want, and so that your expectations are something that I can give to you before you get there.
The recovery went well. It was something that I had never expected or experienced, and in fact I felt so good. I started walking and taking long walks, and I had signed up previously to do the Marine Corps Marathon, which was 5 weeks after the surgery, and I thought, you know, maybe I feel good enough that I can do that. Again, she didn't specifically say don't run a marathon, so I did complete the Marine Corps Marathon 5 weeks after the surgery. I'm a fan of robotic-assisted surgery. For me, it was great. I think in the hands of a skilled surgeon, someone as skilled, obviously, and experienced as Dr. Felluca, it was unlike anything that I experienced, and I'm a real advocate for it. It was great for me.